I chose nursing, first of all, because I love taking care of people, and I love understanding the physiology of the human body. So that's how I went and chose nursing. And then I chose public health nursing because after being in the ICU for so many years, I really felt a call to work on the side of prevention and education, and being on those front lines so that we can hopefully prevent future illnesses and diseases, and have more of an impact on a population level, rather than working with individuals and dealing with like a crisis intervention. More on the preventative side is where my passion is. One of the things that the core nurses do is disease control. So one of the programs we have here is the tuberculosis treatment program. So I follow a caseload of about 20 or so patients at a time who have latent TB infection, and managing their treatment, their prophylactic treatment, so that they don't go on to develop tuberculosis down the road. And then the nurses serve as a strike team for outbreaks, like if there was another outbreak of hepatitis A, or if there were things like, for example, pertussis in Colorado is still at epidemic levels. So we're on the strike teams to do those case investigations and implement disease control measures to prevent the spread further in the community. We have the nutrition division, which is more encompasses programs like WIC, which is a supplemental nutrition program for at-risk families. So they have the opportunity to sit in addition to with the WIC educator, which talks with them about overall healthy nutrition and lifestyles. They could also sit with the registered dietitian and talk about specifics if there's pre-diabetes. In addition, we have what's called the Peak Wellness Program, and they're a cardiovascular prevention program where you'll sit with the nurse to do case management over reducing your risk factors for cardiovascular disease. And a component of that is referral to one of the registered dietitians to have that consultation. Absolutely. Yes, this is my dream job. So I really love where I'm at. I love the flexibility in what we do. I feel like I'm able to do something new every day. I still get one-on-one patient interactions when we go to the clinic setting, but I get to work on prevention more on a population level, and so that's where I always wanted to be. After I realized that I wanted to be more of an educator, so I would absolutely choose this route again. We teach birth control in some high schools and a couple of our districts here in Adams and Arapahoe counties. Go into the refugee centers as well and teach them how to, basically whatever health topic that the women or families are expressing that they want more information on, whether that's cooking our food or how to navigate our transportation system, how to navigate the healthcare system here in the U.S. So we see a lot from refugee camps in Ethiopia. So a lot of people who've come from Somalia originally and moved to Ethiopia, or fled to Ethiopia. Eritrea, which is another very small country near Somalia, as well as our Burmese population. It's opened my eyes to a whole new side of nursing and challenges that people have to face, just adapting. For me, it's the variety in everything that we do. I don't feel like I'm just drudging along doing the same thing every day. I feel like I'm challenged and I can take on new areas of need that arise in the community, and you can really be poised to respond to those needs as a public health nurse. So I love the flexibility and the variability. I think I was just frustrated in the lack of education patients were given prior to undergoing a procedure or prior to going on certain medications. They weren't given the time to sit down with someone and go over, if you continue this unhealthy behavior, this is where you'll end up, this is where you could go. And maybe it's their readiness to hear it too. At the time they weren't ready to hear it, but I just felt like if people could only see this picture before they continued down that path, they wouldn't ever have to be there. They wouldn't ever choose to be there. The barriers, just working in any type of government job, you're going to encounter, certain steps you have to go through, certain processes you have to get approved in order to implement change at a population level. So it just takes a lot of time and patience, and it takes a lot of preparation to make sure you have all of the information and all the data to support what you're doing, making sure everything is evidence-based. We want to only implement things that are evidence-based and we know will work. Stay focused on what your ultimate goal is. It doesn't mean you can't take a couple rabbit trails to get there. Just knowing where your heart lies, that wherever you're at in that moment, if you're not at that point yet, just realize that it's only temporary, that you have an end goal in mind and a way that you want to navigate getting there. Healthier behaviors among mothers and children. Colorado is one of the least affordable states for childcare. And so with that exorbitant bill, they have to work long hours, nights and weekends, holidays. There's got to be something in place where healthy behaviors, healthy food choices could be immediately available, as are all the fast food joints. I feel like fruits and vegetables should be as easily accessible. I just wish that we could bring that access to them so that they wouldn't have to feel trapped. We need to educate the people at that level how obesity and poverty are related. And so if they could kind of see that picture and see the long-term consequences for us as a whole nation, they would be more inclined to subsidize healthy foods like fresh fruits and vegetables. And like if they don't have that foundation, everything else is being done off of, whether it's adrenaline or stress or just their own ways that they've learned how to cope around the chronic toxic stress in their life. But if you can give them that foundation, it allows them the chance to have a healthy development of the architecture of their brain.